More people die from heart attacks between Christmas and January 1st than at any other time of the year. It's according to the American Heart Association. Dr. Paul Tucker, cardiologist who practices at St. David's South Austin Medical Center, joins us this morning to talk a little bit more about this and how we can reduce our risk during this time and beyond. Good morning, doctor. Thanks for joining us.
Hi, thanks for having me.
Yeah,
Merry
absolutely.
Christmas.
Yes, Merry Christmas to you as well. Tell us a little bit about the risk of heart attacks, specifically during the holidays. This is pretty interesting that during this time they're higher.
Yeah, it's interesting, I think, to most people who aren't in the medical field, but to us, it's pretty common. We see a huge spike in just all sorts of things around the winter months, but especially the holidays. The holidays especially, for many reasons, are stressful. Sometimes people are, having, family issues, or maybe they're alone. Sometimes during the holidays, people stop doing what they're supposed to do, like, daily exercise, watching their diet. They go to a lot more parties. There's a lot more alcohol and food consumed. So it's just kind of although the holidays are a lot of fun, for some people, it's a little bit maybe too much fun, and they can end up having problems related to that.
Right. And talk a little bit about what too much fun means. In fact, we're all indulging on so many things, but what is a good amount of food, of drinks that you should be consuming? Right.
Well, again, not trying to, be a Grinch or anything, but I think if people can stick to their routines as much as possible during the holidays, if it's trying to make sure you're still doing your daily exercise. For goodness sakes, keep taking your medicines, especially if you're on blood pressure or any sort of heart medicine at all. It's amazing how many people kind of just give that a pass over the holidays. It's really just a matter of, always trying to do things in moderation.
Absolutely. And you said, you don't mean to be a Grinch, but I'd like to really exemplify that it's not that you're being a Grinch. It's, these things can really help save someone's life.
Oh, sure. Yeah. I mean, there's a lot of things that go on during the holidays that are that happen to your body. First of all, just because of the stress of shopping and driving, and traffic is crazy, which we've all seen this last week. Your cortisol levels go up, your adrenaline levels go up. Those are stress hormones, and they increase your blood pressure, increase your heart rate. They turn on your clotting system, which might make you a little bit more prone to, a heart attack or something like that. We definitely see a spike in heart attacks and heart-related problems during the holiday season. There's kind of a term for it called holiday heart syndrome. And it can be anything from heart attacks to arrhythmias like atrial fibrillation, atrial tachycardia, some even more serious arrhythmias than that.
Now, doctor, we've talked a lot about what can happen and what you see. Let's talk a little bit about what people can notice. What are some early signs that are being ignored by folks as they're going about? What's something that, we should really pay attention to if something were to happen?
Right. So the common symptoms, if you're having a heart problem, could be anything from palpitations, like your heart racing, to maybe not even being aware of that, but just being really dizzy or lightheaded suddenly. That's kind of a warning sign that you should get checked out pretty quickly. Chest pain, of course, is one of the common symptoms of a heart attack, but not everyone has the classic elephant on the chest type of situation. Women tend to have different symptoms than men, but the discomfort, if you're having a heart attack, could be anything from chest pressure, tightness or heaviness, to pain in the jaws, pain in the middle of the back, which is very common in women between the shoulder blades. Sometimes it's just left arm pain or something like that. If you're not sure, if you have any doubt at all that something's going on, get help. Call 911 and get to the hospital.
All right. And yeah, that was my last question. If you are finding that these symptoms are happening or noticing them in a loved one, don't wait for the doctor, 911, correct?
Right, and don't call your primary care doctor. Don't call your cardiologist. We will be called by the ER. We promise. They'll call us. But get to the ER first by calling 911 if you're having that kind of a problem. And a lot of people go to the ER for chest pain and don't end up having to stay because they're not actually having a heart attack. But it's obviously better to be safe than sorry.
Absolutely. All right. Well, we appreciate your time this morning. Thanks so much for helping save our lives, Dr. Paul Tucker. We appreciate your time this morning.
Thank you. Merry Christmas to all your viewers.
Thank you. Likewise.